Well, it's more than obvious that this difference in smoking and tobacco-related deaths are associated with a large difference in smoking rates between the two countries. Greece has been traditionally a very fanatic smoking country, I must say. The smoking rates have been very, very, very high in the past, exceeding 40% in the general population, exceeding 50% among men. But in women also, smoking was quite prevalent. Unlike in some other countries where there are very big differences between women and men in smoking rates. We have seen a significant improvement in Greece. Over the past several years, smoking rates have been going down. In 2017, when we did a study which was basically about examining e-cigarette use in the population, we found the smoking rates to be around 33%. Now I think they're below 30%. I must say that this reduction in smoking rates in Greece has been associated, maybe has coincided, to be more exact, with the introduction of novel harm reduction products and the increased awareness and popularity of these products. So in 2017, already the e-cigarette use rate was 5% in the general population, with adult population, with the vast majority, I'm talking about more than 98.5%, being current and former smokers. Since then, mainly in 2016 to 2017, we had the introduction of heated tobacco products in the market, and they have been quite popular. Unfortunately, the problem is data collection. We don't have enough data. Basically, we tried to do some research, but we couldn't find the relevant funding for it, in order to see how the smoking rates may be linked to the availability and to the use of harm reduction products. We've seen some data which are mainly coming from information released from the industry itself, but we haven't seen a large population representative survey that would determine and especially examine former smokers to see how they have managed to quit smoking and what, if any, nicotine-containing product they're using now. I strongly suspect that we're going to find a substantial link, something that, for example, we have seen in Japan, where the cigarette sales have gone down to almost 50%, from 180 billion tobacco cigarettes in 2015, 2016 to less than 100 billion in 2022. An amazing difference, an amazing reduction, which coincided with the introduction and the very fast adoption from smokers of heated tobacco products there. I suspect that there is something similar happening in Greece, but we haven't documented it, and that's the importance, of research. There are some surveys that are being performed on the smoking rates, but no one has attempted to make this link. And how do you make the link? You simply look at current and former smokers and their past attempts to quit, or what they're using now for specifically for former smokers. No one has been doing that because, unfortunately, no one is really interested in tobacco harm reduction. So we have a sort of a success rate in Greece in terms of reduction in smoking rates, nothing similar to Sweden. But what is important, and I would like to address for Sweden, is that Sweden has low smoking, but not low nicotine use rates. Let's not forget that the nicotine use rate in Sweden is identical, without any statistical significance, any statistically significant difference, to the nicotine use rate in the rest of the European Union. What is different in Sweden compared to the rest of the European Union is the source of nicotine intake. So in Sweden, the main source of nicotine intake for the population is snus, as we know. Instead, in normal other countries, including Greece, the main source of nicotine intake has been the tobacco cigarette. And looking at the difference in smoking and tobacco-related deaths in Sweden compared to the other countries, EU member states, I think it is important to emphasize that this is a determining factor. We shouldn't look at nicotine use rate. We should look at smoking rates, and by doing this, we will understand how valuable harm reduction has been in Sweden. Sweden is today the only basically smoke-free country in the world. But since this product, snus, a harm reduction product, has been used in Sweden traditionally, we already have the outcome of this in terms of population health effects. So the very low smoking rates, accompanied by very low death rates from lung cancer, from cancer in other organs, from cardiovascular disease, even from oral cancer, because there has been a lot of speculation and misperception about an oral smokeless tobacco product causing or being linked with an increased risk for oral cancer. It has not been the case with snus. So Sweden, and especially men, because let's not forget that men has largely adopted snus use instead of smoking. And now with the evolution of nicotine pouches, pouches are becoming a more appealing product for women to substitute for smoking. And this is something that we need to emphasize. So we need to learn the lesson. And I think Greece, which has been a very bad example in terms of smoking, we need to learn the lessons from Sweden. And I must emphasize, we need to look at the evidence and look for data to examine if there is any link between the reduction in smoking rates that we are observing in Greece, which of course are still too high, but lower than in the past, with the introduction, availability, appeal, and use of harm reduction products in the country. There have been some improvements in the regulators and government's approach to tobacco harm reduction. Unfortunately, in the past, the government was pretty much opposed to harm reduction, and they tried to introduce several restrictions in the legislation concerning harm reduction products. The government today is quite supportive of harm reduction, of course, not vocal to the level of, for example, the UK authorities, but at least they understand that harm reduction can be an ally in smoking control and in reducing smoking rates, instead of what has been unfortunately very common throughout Europe, considering harm reduction as a threat to smoking control efforts. Sweden and the Swedish population mainly, not so much the regulatory authorities, have been a bright example. They have achieved to become a smoke-free country 17 years before the EU set goal of having a smoke-free European Union. And to be honest, with the current approach, I doubt that even 2040 is good enough to set that goal and to achieve that goal. Without harm reduction, and that's, I think, the main point in conclusion, you can't have a smoke-free country without adopting harm reduction. That's the reality. I understand that in an ideal world, we could have no nicotine use, but in the same way, we would have no crime, no traffic accidents, no death from diseases. We don't live in an ideal world. We need to be pragmatic. We need to be realistic. We need to see the example of a country which has become smoke-free, and we need to follow this example.